All right, we're going to be doing an examination on Ariana today for a caries detection unit. Simple USB connect. The USB goes into the computer. We'll connect, simple click. Going to take the protection sleeve or sheath on and put that on in place. So we get it nice and taut. We'll peel this away. And then what Air Techniques has done is they've created these special stands that snap onto the end of the camera, and it makes the perfect focal distance for us to get the right image. Can I open up, Ariana? Thank you. I'm going to blow some air in your teeth. I just like it to stay open. And what I'm doing is just blowing all the saliva away before we do our caries detection scan with Spectra here. And I'm going to place the handpiece over the tooth. So all I'm going to do is anytime I see any red fluorescence of a tooth, I'm going to capture an image here. The red tells me there's some kind of activity on the tooth, and I want to be able to look at the tooth a little further and diagnose what's going on. Good news here, she has pretty healthy teeth. So just to kind of give her a baseline, I am going to get an image of something that's just normal. So we have it. I'm going to scan over. I'm going to go over all the maxillary teeth here. She definitely has an area that's fluorescing on the camera. Okay, so here she has a sealant, and right on the outer periphery of that sealant, there's some breakdown. So we want to image that because we may have something more than just stain. I also like to take a look at the inside of the lower arch and see if there's any areas where there's plaque buildup that the patient may be missing. As I come around the lower front teeth, this area patients tend to miss a little plaque because it can be built up. We're going to bring you up and discuss some of the images that we took today. So you'll notice three spots where there's red. Those red areas tell us it's starting to get deeper into enamel and it's almost the dentin. It's not quite there yet, but it's getting close. So when I see areas like that, the beauty with dentistry today is we can keep it really conservative. So we can do a really small filling, almost like a sealant, or something we call preventative resin, where you might not even need to get you numb for it, and fill those areas in and stop the disease process there. The areas that are in blue, and there's a few other areas in your mouth that have the same thing, that's where I'm going to recommend just a couple different brushing habits, as well as we might put you on a stronger concentration of fluoride and some xylitol. And the goal is there to help stop the decay before it gets any worse. Good news is when we catch it in this blue stage, many times we can stop it, and it will stay like that for many, many, many years, so it'll stop itself completely.